Fantastic. Okay, I think we can pretty much get started. Hi, Bronwyn. Lovely to meet you. Fantastic. Yes, so for anyone who has just joined, please do drop your name and where you're calling in from today into the chat. It would be lovely to meet you. We're about to get started. Hi, Ben. Lovely to see you. And a huge welcome to all of you. We're very excited for today's discussion. I'll start by introducing myself. My name is Marion. I am the VP of Marketing at Walking on Earth, or ONE for short. We are the leading preventative health platform for the workplace. I'll start by giving you a little bit of context about our business. So we have a really bold mission. Our mission is to reduce stress for 100 million lives. And the reason we want to do that is because we know that a healthy workforce is a high-performing workforce. So our platform provides employees with real-time stress reduction, as well as helping them build lasting resilience. And in doing so, we help organizations with managing their costs that are associated with stress and poor health. And I think what's really important to share today is that we've spent many, many years studying the science of stress and how it affects not just individual health, but also outcomes for organizations and performance for individuals. And so what we're here to discuss today and what our research is really about is understanding how much stress is silently costing organizations. And so the research that we'll be interrogating today is called Risky Business, the Hidden Cost of Stress. And I'll drop the link into the chat in just a moment for those of you who may not have seen it just yet. I'm particularly excited to introduce our panelists. Everybody that is here today has contributed to this research in detail. And so they have some incredible insights and learnings to share with you all. So I'm just going to introduce each of them to start out with. First of all, Dr. Lydia Roos is a health psychologist, a stress scientist, and is our Chief Scientific Officer here at ONE. She earned her PhD from UNC Charlotte and conducted research at UCLA as well as Stanford Medicine. Yvonne Sonsino is a partner at Mercer and specializes in total well-being and longevity. Yvonne has advised global corporate clients for several decades and has worked both for governments and the World Economic Forum on longevity-related topics, as well as writing her own book, The New Rules for Living Longer. And then finally, Laura Jackson was previously Global Head of Wellbeing and Benefit Strategy at Credit Suisse, and is now an independent wellbeing and benefits strategic advisor, having worked in the financial services sector for 25 years. So as you can see, we have a stellar lineup for you today. I'm very excited to bring this group of thought leaders together. We'll be here for the next roughly 40 minutes. So please do drop any questions that you have along the way into the chat, and I'll endeavour to ask them as we go along, but we'll also have time at the end for any Q&A that you may have. So with that, let's dive in to the session. And I'll start with the first question for you, Lydia. So Lydia, you led Risky Business, the research for the study. And I think it would be a good starting point for you to tell us what actually went into the study and a high level of the key findings that you produced.
Yeah, absolutely. So in this paper, we introduced a new scientific theory, what we call the stress risk thermometer, which we then validated with data from over 1,000 full-time employees from the US and the UK in technology and professional services industries. So essentially the background on this is we know as scientists that there are hundreds of kind of disparate studies that measure the amount of different types of business risks that stress can affect, things like absenteeism, performance, engagement, and turnover. But they're all kind of disparate lines of research. There wasn't really any one comprehensive theory that accounted for all of these different types of business risks that we would expect to be affected by stress, as well as kind of at what point do we affect stress to really impact these risks. So we developed the stress risk thermometer as a way of conceptualizing that as stress increases, we would also expect to see business risk increase. So then we also determined what types of business risks we would expect to be impacted by stress. And we came up with 17 different business risks across 5 categories. So to test this theory, we recruited 1,005 participants from the US and the UK. And Marion, if you wouldn't mind pulling up that slide, thank you. So all of whom were employed full-time at the time of data collection. We especially targeted industries that you can see here. That's legal, financial services, technology, business services, and marketing. And participants completed our one index. So that's our scientifically validated measure of stress and resilience. And for this study, we really focused on the work-related stress subscale. So that asked participants how stressed, anxious, and overwhelmed they felt in the past 1 month at work on a scale of none of the time to all of the time. And they also responded to 17 questions that represented the risk categories that are shown here. So that included workforce loss, like things like unplanned absenteeism and intention to leave their job. Performance and engagement, that's things like overall focus, productivity at work, how engaged someone feels with their job and how engaged they are when they're completing specific tasks at work, their ability to manage their time and problem solve. And then we also conceptualize this critical operational risk category. So these are things that we kind of pulled together specifically because the risks captured here could put any organization at a heightened risk, much more so even than the other ones. So that includes things like missed deadlines, making serious errors at work, and cutting corners at work in ways that could put their organization at a compliance risk. And then we have relationships at work, and that includes feelings of things like irritation and hostility towards others. As we know, those kinds of things can lead to toxic work environments that are unhealthy and less productive for everyone involved, as well as whether relationships at work are generally harmonious and the quality of their relationships with their manager. And then finally, we measured non-preventative health claims over the past 6 months. And so in terms of the findings, so indeed we found that the results very much aligned with our stress risk thermometer theory. And I don't say that lightly, that in my 13 years as a researcher, I have never seen results that were that strong and that consistent across every area that we assessed. It was just very consistent evidence. And so, Marion, if you would mind switching to the next slide, that'd be great. Thanks. So what we found was stress was significantly and strongly associated with all 17 business risks in a dose response pattern. So for context, for both the stress and the risk items, we categorize them such that if a person responded that they had experienced this thing or situation, or that they did participated in this behavior, none of the time or rarely, we put them in the low risk bucket. If they responded that they do this sometimes, we put them in the moderate risk bucket. And if they responded that they do this frequently or all the time, then we put them in the high risk bucket. And so the results were really striking. So we found 45% of the people that we surveyed reported being stressed at work frequently or all of the time. That's huge. And another 41% reported being stressed at least sometimes. And only 14% of the population that we surveyed reported that they were not stressed at work. And then importantly, it's not just that they were feeling stressed, but that this stress clearly linked to heightened business risks. So what we can see on the figure, in the figure on the left, is that with each increase in stress, there was a requisite increase in likelihood that a person was reporting moderate or high risk. So at that lowest level, we're seeing very few people are reporting anything at high risk. Only a few people are reporting moderate risk. And then each time, though, that we go up a stress level, those percentages increase. And then the figure on the right dives into the proportions of employees reporting these high risks as well, along with some of the expected outcomes that we would see kind of on an individual level, as well as impacts on the business. And so those aspects of our stress risk thermometer theory are really built on decades of stress and organizational science research. And our findings are really supporting these links between stress and business outcomes. So there's a lot of information in that visual. I'm not going to go into detail on it now, but it is really interesting and really goes into detail on all of those mechanisms involved. So I highly recommend that you download the white paper if you haven't already done so you can actually read through all of that too.
Amazing. Thank you so much, Lydia. It's really striking to me that there is such a strong correlation between high stress and high risk. And I think, our study really focused in on stress, and it's important for us to take a step back and have a look at the broader risk landscape. So I'd love to ask you, Yvonne, in your role at Mercer, you see a lot around a much broader risk landscape. And so could you talk us through how stress fits into that landscape and why it's important for organizations to take a preventative approach to mitigating this risk?
Yeah, thank you, Marian. And first of all, can I just say congratulations to the One team for producing such a comprehensive report. I worked with you on part of it, contributed, and certainly the team worked so hard, and I'm really pleased to see it out there. So Mercer, for those of you who don't know, we specialise in all aspects of people. And we produce a people risk framework, and there's mention of it in your white paper, actually. We look at this broader people risk landscape and categorise those risks into 5 different buckets. So there's technological change and disruption and the acceleration of AI and automation. All of these are threats around job security, skill requirements, workplace culture. We look at talent, leadership and workforce practices, quite an overlap with what you've looked at there. The next bucket is health, well-being and safety, and rising levels of stress and burnout and mental health issues are now key workforce risks in our research too, alongside the traditional risks that would have fell into that bucket, which it's always been known as health and safety. Now to have expanded it to health, well-being and safety, you can see where that's going. There's also governance, compliance and financing risk. Again, your research and your 17 risk categories touch into areas of this, a compliance risk, a mistake in some of these key industries that you've been working with represents enormous business and reputational risk. And then the final bucket that we look at is the environmental, the sustainability and protection risks. So things like climate stress, financial stress, shifting employee values and workforce stability. So there's a really, really broad landscape out there. Our parent companies, Marsh McLennan, again, many of you may have heard of Marsh McLennan. We work with the World Economic Forum on a global risks report. So there's 33 risk categories in there, and they're very, very much broader: geopolitical, social, environmental risks, of which people is one aspect. So I think in putting it into that broader context and how stress impacts business risk, I think it's clear it's definitely rising levels of burnout and mental health issues that are leading to increased costs, as you've outlined in your report, and increased business risk and poor productivity. I think a couple of other things I touch on in this area. Certainly there are broader change is happening at a global level. So when we think about demographics, for example, this is an area of specialism for me, looking at longevity and demographic implications. We're living longer as a population. I've just been reading a report produced by the European Commission in the last few months, and it states that in the 5 years from 2015 to 2020, there were 3.5 million people reduction in the European workforce because of shrinking birth rates and aging populations. So the combination of those two macro trends is having massive implications for workforces generally. So people are having to live longer. On average, people are living 10 to 11 years in poor health. As they live longer, they need to work longer to finance that longer life expectancy. So they're living longer, finances are stretched, they're in poor health. All of this leads back to how the workplace can help support them in that journey. We look at that from a very holistic point of view. So when I look at well-being, total well-being, again, another area I work in, we look at people's physical health, their mental health, their financial health, their social health, so their networks, their communities. And we also look at career health, so, that job satisfaction, job security. So what you're doing in your reporting, your research, you're really honing in on those workplace issues. They're part of a very, very complex, very multifaceted situation in the workplace. And certainly what we need to do is start to analyse, well, where are those risks coming from? Is it job design? Is it job insecurity? Is it the implications of technological change and disruption? Where are the pressures coming from? So I think it's a really important area, and look forward to seeing what more can be done here.
Thank you, Yvonne. I think one of the main takeaways that I had from our conversations was how interconnected these risks all are. And I found it so fascinating seeing the data from the study as well, and how interconnected a lot of those outcomes are as well. And I think, we've had the study, a little bit of understanding around that. We've had the macro view of what's happening from a broader risk landscape. And I'd love to now dive into how some of those interconnected risks are actually materializing in the real world. And so, Laura, obviously in your role, leading global teams in a really high pressure organization at Credit Suisse previously, you've had firsthand experience of how this has impacted not just individuals and their health, but also organizational outcomes. And so I'd love to understand a little bit from your perspective how this is manifested.
Yes, no, absolutely. I think the first thing I wanted to say, though, was maybe just step back a tiny bit, because I agree with Yvonne. It is a very complex, multifaceted, stress within an organization is not very easy to necessarily pinpoint. But I do think there are a number of basic people metrics that a lot of individuals here on the phone could actually, readily get hold of. So first of all, staff turnover. I mean, if you're seeing an increasing number of resignations, particularly even if it's just in one department, these are all signs. Another metric would be absenteeism, a lot of short absences or unplanned absences or some sort of pattern that looks slightly unusual. Health data has already been touched on in respect of medical claims and stress-related illnesses. If you're seeing a number of individuals coming forward, not necessarily being able to identify quite what's wrong, even they might not know what the word is that they're experiencing. Employee grievances is another really good one. And this isn't necessarily just grievances employee with manager. It might actually be disharmony amongst employees, which is where one person is increasingly getting more and more stressed and anxious dealing with individuals within their team. Productivity, if you have the ability to monitor productivity, and I think this is easier for consulting firms and legal firms where they have a billable hours concept, you can definitely see productivity, dip, which is potentially another sign. And then error rates. Again, I think you've touched on health and safety incidents, but it might just be mistakes, increasingly seeing, simple errors coming through that wouldn't necessarily be there. So I just thought it's important to sort of say that there are some basic people metrics that people couldn't look at. It is very complex, don't get me wrong. And yes, you did ask about a couple of examples, and I've got 2 real examples, which I'm sure, people will kind of ring true, possibly, of things they've heard. But within a top legal firm, there were 3 individuals, they were director level, vying for a partnership promotion. And the unwritten rule was that it's all about billable hours. Now, unfortunately, this did manifest itself in one individual, investing so much time in billable hours, but then ended up being off on stress for a 4-month period. And if here I was sort of correcting the wrong, what I would say is I don't believe the company had invested enough in really explaining what it meant to be a partner. So it's not just about billable hours. It might be about your client relationship skills or your people management skills or problem solving. So, sometimes there is a company responsibility here to kind of make sure that individuals don't become stressed at certain promotion opportunities. So that's one example. And then secondly was within a financial services organization. Unfortunately, 2 out of the team were out on planned absences, and they're relatively long absences. And unfortunately here, the pressure on the people was constantly to do more with less. What I mean is less people, but no more headcount coming in. There's often a delay, unfortunately, even with planned absences, being able to get staff in at the right point. And unfortunately here, I would say that the stress really had a ripple effect across the entire team, and probably created quite a lot, dare I say, of animosity with the manager, who just, if I'm honest, just put his head in the sand. To the point at which it led to, unfortunately, that individual, the manager himself, actually being off on stress. So here, although I would say it's probably a failing of the manager to acknowledge the issue and deal with it promptly, there was also a bit of an issue from a company perspective that they hadn't necessarily supported planned absences effectively in that particular department. One individual off, maybe you can cope, but 2, it starts to get difficult on relatively small teams. And here I'd say, really also the manager should have tried to normalise conversations around mental health in team meetings. And it's very easy. The simple question is, how is everyone feeling? It is not a complicated question. You don't have to mention anything else. How is everyone feeling? And if you work with teams for long enough, even if you can just tell slightly, maybe in a physical reaction to that question or a facial reaction to that question, something is not quite right. And then what I would suggest is just ask the question again, possibly in a kind of private environment, to try and dig deep into what that situation is. And that for me is around creating a psychologically safe and open environment. And I will also just touch here a moment on healthy teams. People underestimate how important having a really good team are, so that when workload's difficult, other people sort of just stay late and try and help out where they can, even if it's just like bringing in lunch. It's really important to have a healthy team that work really well together, and then they build strong relationships, and then as a group they feel much more comfortable addressing issues with, maybe workload imbalances or job design, as Yvonne touched on, or poor communication. And if they are also seeing management behaviour which isn't appropriate and is actually exacerbating the issue within the team, as a group, they might feel brave enough to raise it. So that healthy teams is critically important.
That's such valuable insight in terms of really bringing it down to everyday experiences. And I'm pretty sure everybody on the call will be able to identify those examples. So thank you so much for sharing them. I think what's a really interesting concept to introduce at this point is the individual and the business is both experiencing this stress risk thermometer. And so even just taking a moment right now to think about perhaps where you as an individual sit on that stress risk thermometer, if you're in low stress, medium stress, or high stress, and maybe what the behaviors or feelings are happening to you in those different states, and then how they might be manifesting in an organizational environment from a business leader lens, what that might look like as a cost to your organization for your team around you that are potentially battling through this high stress environment. I think what would be a great pivot now is to actually dive into some of those quantifiable data points. So Lydia, perhaps you can now take us through the actual findings from the research.
Yeah, absolutely. And if you wouldn't mind bringing up the next slide, that would be great too. So yeah, so as we've discussed, this is not a small percentage of the workforce that's experiencing this really high, potentially chronically high level of stress. And that matters because as we're talking about it, this is not just theoretical. These can really translate to measurable business costs. So given the immense impacts then of stress on business outcomes, that means that we really have some serious repercussions on our hands if we don't do something about it. So our research is showing that for a 1,000 person organization, high stress is estimated to cost an extra 5.3 million annually in absenteeism, presenteeism, and turnover costs. So that's even before we're considering the operational risks like missed deadlines, compliance failures, deteriorating client relationships, and so much more. So specifically, our research uncovered that high stress employees are costing an organization approximately $12,000 more per employee compared to their low stress colleagues. And so we can break that down into the specific areas of costs that we looked at here. So first, there's absenteeism. So high stress employees, we found, take 8 times as many sick days due to stress specifically compared to low stress employees. And in a 1,000-person company where 45% of employees are experiencing those high levels of stress, that translates to about 2,700 sick days annually. And then to arrive at what the potential actual financial cost of that would be, we used participants' own reported salaries in these data to estimate that direct cost, and that would be approximately $778,000. And then we examined presenteeism. So that's employees are physically present, but maybe not mentally engaged, or they're just not performing at their potential due to some kind of mental or physical health concern, stress, those kinds of things. And even, stress is actually very highly influential in other aspects of mental and physical health. So our data showed that 27% of high stress employees are also highly disengaged. And that's compared to just 8% of low stress employees. So that kind of hidden productivity loss is estimated to cost around 1 million annually for every 1,000 employees. That is not a low number. And then perhaps most costly in terms of just direct financial impact is turnover. So high stress employees are 3.7 times more likely to consider leaving their organization. And then when we factor in research that estimates that about a third of those people who are considering leaving or want to leave their organization actually end up leaving within the next year, then we see the full costs of replacement, such as recruitment, onboarding, lost productivity during transitions. That adds up to about 3.5 million annually for a 1,000-person company. So of course, then we kind of want to look at, okay, what is not exactly quantifiable here, or is just like less easily quantifiable. So we found that stress significantly impacts operational performance. So high stress employees are 11 times more likely to make mistakes, miss deadlines than their low stress colleagues. And in industries like finance and technology, where a single error can have really big consequences, that presents a really substantial risk exposure. And then when asked about cutting corners in ways that can put their organization at risk, we found actually that no employees who were in the low stress group reported doing that. 12% of employees in the high stress group did. So that should really tell you about how impactful stress can be on a pressure to get things done fast, but also maybe not being completely mentally present or not having, the kind of facilities that we need in the mental resources that we really need to do our best. And then another particularly concerning finding is really how stress affects workplace relationships. So our data is showing that employees experiencing high stress are 7 times more likely to experience hostility towards colleagues. And that tension obviously does not just affect the individuals involved, but as we discussed earlier, it erodes team cohesion, it erodes collaborative problem solving, psychological safety, and just overall organizational culture. And then finally, we really can't overlook the health impact either. So high stress employees file 2.5 times more health claims, that's non-preventative health claims, than low stress employees. That can drive up insurance premiums for businesses, for the entire organization. And so although we don't have that as an added expense here, we know that health insurance is really costly for businesses and it's second only to salaries. So it's definitely something to consider. And then I just want to say that I think, in my opinion, what makes these findings really troubling is that stress tends to not be an on-off switch. It tends to creep up pretty gradually. And by the time organizations really notice these spikes in absenteeism and turnover, those underlying drivers of stress have been active for months. So it really underscores why measurement and early intervention is really critical for managing these risks and avoiding those additional costs that you don't have to live with.
Thank you for sharing that. I think when we saw these findings, there was a sense of just shock, I think, at how significantly it impacts not just the individual, but how it is represented in business outcomes as well. And I think it's important for everybody on this call to be armed with this data, to be able to have these conversations internally so that you can do something about it. But it's not all doom and gloom. There is actually something that you can do about it. And when we were discussing the webinar, the first thing that we recommend you do was something that every panelist on the call felt very, very strongly about. And that is the role of measurement. And to Lydia's point, it's really about arming yourselves with the data to understand when things start going wrong so that you can take proactive action to do something about it before it gets to a crisis point and before you start seeing some of those metrics in your organization. And so I'm going to just sort of do a round robin for each of the panelists and ask you one by one to share a recommendation specifically focused on measurement and how you would use measurement to drive proactive action. So Yvonne, perhaps we could start with you.
Yeah, thank you. Really, really interesting findings, Lydia. Thank you for putting all that together so succinctly. It's multifaceted, as we've talked about earlier, and this big broad picture I referred to earlier, what's driving, what's causing stress. We find many of the companies that we work with now are looking at producing these wellbeing dashboards, but they're actually quite hard to get the data for. Laura and Lydia, you've both touched on some of the potential metrics, but they're not easy to get hold of. even the biggest, best run companies don't have a bunch of data scientists in their HR team ready to upload these facts and figures. So you've got to make these wellbeing dashboards manageable. So just start small, I would say, and don't try and measure something every week or every month. I'd say 6 monthly, maybe even annually to start with, so that you can start to show trends and see trends. But I would advocate that we have to look at this broad picture. So there will be things from a physical perspective, a mental perspective, a financial perspective, social perspective, and career perspective that could be those underlying stressors, those underlying causes. So maybe you pick 1 or 2 measurables from each of those areas to see what's driving that stress and then monitor it over time. A good example actually is financial well-being. We saw a year or 2 ago when there were very high interest rates, high inflation, salaries not keeping pace with inflation, people felt really, really financially vulnerable. So there's a massive increase in interest in financial education. That has actually now come back down a little bit, possibly because of interventions, possibly because of trends. But unless you're measuring it and looking at those trends long term, and you can capture like for like longitudinal data, then it's not worth doing unless you can do it well. So keep it simple.
Amazing, thank you. Laura, how about for you?
Yeah, so I agree with Yvonne. You know, there is a lot of data out there, and it's really about how much you can access. But there you know, some things I've touched on. Some of those data points are relatively easy, I believe, to find. Certainly, you know, turnover and health data and absenteeism. If you've got a decent absent management tool, relatively easy to get your hands on. But I agree with Yvonne. It's then what I would say is the interpretation of that data. So you take the quantitative data, and probably within an HR department, you also have some really known qualitative case studies or qualitative words that you can use to match quite nicely the quantitative data, and then you bring those 2 together. I do really like, you know, the sort of one tool, because what I would say is, you know, within HR, we don't necessarily always have the skills, or dare I say the time, to be able to interpret that data and pull it all together. And, you know, the other thing I would say is stress is not necessarily work-related stress. You know, Yvonne's given a good example there of financial. Stress can be a lot of things outside of the work. It just manifests itself potentially in the work environment. So measuring stress is something that I think everyone has a responsibility to do, but it might make sense to have an external party come in and do it without a certain amount of bias or expectation about the results. That's what I would say.
And I think that leads really nicely into you, Lydia. Thank you, Laura. Lydia, how about for yourself?
Yeah, exactly. I mean, I can't echo what you both have said enough. That both of what you have said has been, it's incredibly important. And as we're talking about, measurement is key. You can't improve what you don't measure. You can try, but you are potentially wasting resources on things that will have little to no impact. So you really need good measurement tools to take the guesswork out and give you some real insights. And then I think the other part is then giving you the tools that you need to improve in those areas. And so I love what you said, Laura, about getting some kind of easier data through HR, things like turnover, absenteeism. But then the next question is, what is driving those outcomes? So yes, we know that that absenteeism seems to be on the rise, or maybe even performance seems to be reducing, but why? What's going on there? And are there particular teams or levels that we really need to dig into and find out what's going on there? So I suggest kind of layering, as Laura was saying, layering the HR data that you're able to get with something like a stress measurement dashboard, partnering with someone like One. Not that I'm biased, but I do think that we do a pretty good job here. And I think that, you know, then we're able to kind of combine those data and really see what are the main stress drivers in the organization as a whole, as well as by department, by team level, or by team and level. For example, like if we're comparing managers versus non-managers, and then tracking the outcomes that we know that are related to stress, like engagement, turnover, performance. And so I think kind of having a central dashboard, like the ones that we develop with companies, can help companies then spot the trends and understand where and how to intervene. So that type of measurement could really then make a company much more effective and proactive at dealing with stress, can avoid a lot of the larger risks that we see in that white paper. And I also think, it's worth pointing out that I think aspects of measurement like turnover, absenteeism, those are relatively simple things to measure, right? Like most HR teams are going to have those data. When you're talking about, and I say this as someone who has had the specialized training in psychometrics, when you're talking about developing survey items and knowing how to group items, how many items do you need to tackle a certain factor that you want to assess? What are the most important things to look at there? How do you analyze the data? How do you, see the trends and see the connections between these data? How quickly would you expect something to actually change if you are, intervening, if you're introducing some new type of training or something? How quickly would you expect something to change so that you can actually measure whether it's effective? And I think that's something that I would not expect most people to have the training in, but it's something that we like to be able to have as kind of a complementary, value prop to HR, so that we can really combine what we can do and make the most sense out of the data and make the most impact with the data. And then I would also say that, of course, so we know that from the data that we've assessed in the white paper, actually, that about 61% of employee stress stems from the organizational kind of factors. And for example, how work is designed, appropriate workloads, feeling connected and supported at work, financial security, as we've discussed, psychological safety is a big one. And so workplaces then truly prioritizing and supporting physical health and mental and emotional well-being is really key. But there may be some areas that need more attention than others. There may be micro environments kind of that are within the company that are less healthy than other aspects of the company and need a targeted intervention. And so knowing that things aren't just always as straightforward as they originally sound, this is exactly why one offers this to employees, to really dig in deep and see what are the issues from a systemic perspective and where can we intervene to have the most impact.
Fantastic. Thanks so much, Lydia. I'm very conscious of time. We did want to dive more deeply into all of the recommendations. We have 5 categories in the research, with recommendations ranging from individual interventions to organizational interventions, the measurement piece, which we've just talked about in detail, and more. I think there's an important role for bringing risk and HR functions together in order for this to be elevated beyond just being a people issue. And I would encourage you, if you haven't already, to download the reports. I think we don't have time to dive into them anymore today, but I would love to open the floor for any final thoughts from our panelists before we close. And I will share one item in the chat while you are sharing final thoughts.
I'll jump in there because I totally agree that actually stress is just really another measurable risk, just like financial risk, just like organizational risk. And stress is not necessarily a negative. I mean, an element of stress is good. It creates energy, it creates excitement. The issue is continual stress and high levels of stress that are the problem. So I really think the hybrid approach between the HR and the risk department is good, because risk look at it very objectively with a risk lens. And the secondly and very last thing I'm going to say is, please get your ducks in a row, because I have a very strong feeling there's going to be more and more regulatory pressure passed down by governments for organisations to handle and get hold of workplace mental health, because it's manifesting into, you know, the NHS and the US health departments. You know, there's just too many people, unfortunately, dealing with mental health, and therefore I think the government's going to bring more and more regulatory pressure onto companies.
Thank you, Laura. And Yvonne?
One quite quick thought from me. I love the promotional brand video you've done about how stress builds up slowly. I watched it and personally connected with it. I think we all have a personal responsibility as well to manage our stress levels, to be able to stop the toxic culture in its tracks, to be able to stop that constant pressure. So that would be my final comment. Good video.
Thank you so
And
much.
I think, and just piggybacking on that, in terms of the individual level, so we've talked a lot about the organizational level and the need for companies to step in and potentially make changes there. You know, I talked about 61%, that leaves out the rest of the 39% that individuals, that really comes from individuals. And so we know that stress is typically thought of as a difference between the demands that you have and the resources that you have. And so really amplifying the internal resources in an individual is also super important, and also something that we focus on at One.
Thank you so much, all of you, for your incredible contribution, not just to the research, but to today's discussion. We will be sending a recording and a summary of the key insights from today in a follow-up tomorrow. So to all of you who have joined, please do take the quiz, find out where your business sits in terms of its organizational resilience to stress. Enjoy the brand video. It's a very powerful message. And I wish you all a wonderful day or evening ahead, wherever you are in the world. Thank you very much to everyone who's joined.
Thank you.
Thank
Good
you.
night. Bye.